Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
General principles of inhalational anesthetics. Inhalational agents are important for the maintenance of anesthesia. Classification of inhalational agent. We have There are some inhalational agents which are not used called as obsolete agents. Obsolete agents include enflurane, ether, methoxyflurane, trilene and chloroform, whereas there are some inhalational agents which are currently in use. So all the inhalational agents which are currently in use can be divided into two types. Gaseous inhalational agents are volatile agents. Gaseous agents include nitrous oxide, xenon, entanox, and heliox, whereas volatile inhalational agents include halothane, sevoflurane, isoflurane, and desflurane. Summary. Classifications of inhalational agents. Inhalational agents can be classified into two types: current use and obsolete agents. Current use are gaseous agents and volatile agents. Gaseous agents include nitrous oxide, xenon, entanox, and heliox, whereas volatile agents include halothane, sevoflurane, isoflurane, and desflurane. Obsolete agents include enflurane, ether, methoxyflurane, trilene, and chloroform.
thank you and thank you for watching.